Hi everyone, I'm Taufik Stompul from Indonesia. I will presenting from Indonesian perspective related to the enhancement agriculture resilience to climate change, a data-driven approach with this is two. This is our prototype and also the proof of concept how to utilize the informations about this is two and climate change platform. Yeah. So the context of the Indonesian and maybe globally, we have the climate change is already here, especially with Indonesian perspective, and Mayor Hadar about the significant data gaps across different sectors, such as agriculture, climate, and health program as well. Yeah, our objective from Indonesia to utilize of this is two about leveraging this is two not only from health program but also to another sectoral such as national programs of agriculture and socio-economic indicators, and demonstrating feasibility how to utilize of the DSS2 or data in health programs to another sector, and evaluating effectives and informing policy about the current conditions. So the climate change, we saw some gaps and also escalating crop failures, especially in Indonesia, to increase frequency and intensity of extreme weather, especially direct leading for spreadsheet crop loss. So worsening and food insecurity and complex challenges, especially for to integrating data and also to make sure the decision maker to use and to inform that informations. And designing holistic framework is very ready for now, and especially how to utilize our program, especially to climate smart interventions from cross-cutting ministries and bodies, and utilize of the this is two in our proof of concept here. So many insights through integrations combining local partners, genomic data, and also potential output on social economic. So this is our feasibility, especially how to utilize technology opportunities, because many discussion from many cross-cutting ministries. We saw many technology has been there and established and also synchronized with national program. And we try to utilize our this is too, especially at national levels. The right side, we see a lot of function and technology has been there, like temperature, head, climate change, vegetation, and land cover or elevation. So we try to capture from global data and synchronize with our local data here. So how we utilize of the this is too. So we try to unlocking the integrated insight from climate smart agriculture. I think the most idea here of the climate and health program, we have to find the use case first. In this context, I will try to explain about what's the use case in health programs or climate change. In this is two, we have the uh, platform, nationally central, and also it's only for the healthcare. And I think this is our opportunity to expand our architecture, not only for the health program, but also another health sector like agriculture and climates. So, and the opportunity here, this is too, is not only for the healthcare. We tried in many contexts, such as the subnationals and nutrition bodies, something. We have the proven information. This is a good how to collaborate and how to integrate the indicators. So that's why we use this as tool for the agriculture and climate. So this is the sample. I can say in many contexts I use from the global data from only for the Papua. It's one district in Papua area, because like Kerom is the mountain area. Uh, the head conditions we can see is very difficult to explain for me because I'm not expert for the information, but I utilize the information how to collaborate with another sector. And also the temperature of the head, humidity, temperature of the weather also we utilize from this too. This is the sample of from the Papua. Why in Papua? I think we have to contextual of the Indonesian study. So since 5 or 7 years ago, we have national planning to support of our governments, national governments to establish and how we identify the food estates a test bed for the climate solution. What is the food estate here? Food estates large scale of the integrated agriculture development to design, establish sustainable and efficiency food for production system. We know in Indonesia is a lot of islands, a lot of big islands also, many some land use for the technology and resource massive production. I think this is the opportunity we have to connect with the food estate initiative program. In uh, in that pilot, uh, we refer for 5 provinces, the biggest provinces, and the owner is from the another Ministry of Agriculture and also Ministry of Coordinations Nationals. So the right side we have the Papua or Kerom and Nusa Tenggara or Central Borneo and also North Sumatra in the left side. So here we identify many conditions how to utilize the climate change data. Uh, Unfortunately, it's not good from the local data. We have to try to capture the data and combine with this area. But the good one we utilize from the global reference data from this is too. So this is the sample we want to try to adopt. We want to use the food estates as the context, as the use case here, and comply with this two information. So we hope in the right side of the Papua Kabupaten Kerom is the mountain area. We can identify how they can utilize the information from this two for the food estate in that Papua estate. So the food security is very important, intended to directly support for combating stunting, and also the sustainability of the food condition or food nutrition. We we have the program currently from the one previous president and now the new president's free nutrition meals. It mean if they contextual only from the we are imported from the another countries, but we not prepare of the food from the local, is very difficult to spend our local our national money. We have to provide from the food estate how we can produce the good meals and good food from our the local estate. So food estates serving laboratories for agriculture innovations, especially how to include this climate smart farming and genetic improvement. And the strategic locations in Indonesia is very crucial, especially like the national priority. We have a lot of support from Ministry of Health because they are using this as too as the foundation, metadata and everything's there, but we want to escalate to another agriculture something. So we hope the agriculture output of the programs must be potential use, especially in Indonesia. This is the sample of the program in Indonesia. It's like the school age kids receiving free nutrition uh, every day. So that's why it's very large national money there. So our climate intervention focus for our critical area, enhancing crop yields, especially implementing improved varieties and also precision farming techniques. This is not really to support directly, but if we compare, if we concern with the one Papua food estate, I think this is the idea we want to try this is to support of the local government and also national government of the informations. So what is the strategy and real-time impact, I think we need some importing data from the local here, especially how utilize the landscape, how to utilize land condition, and also the the head of the data from the Indonesian. I think this is the information we can share something. This is too is not only for healthcare but also to support of the agriculture national program and informing one data in Indonesia, especially to support of national programs. Thank you.
Thank you very much. Okay, let's have Carlos present next. You ready? Yes, you are. All right, Carlos has a demo, so he's going to present from his own laptop. You should be a co-host now. A little tricky with glasses. Is that in your pocket?
Okay. Can you hear me? Ellen? Ellen? Yeah, perfect. Thank you very much. Hello, good morning. I'm Carlos Tejo from Solid Lines, and today I want to talk about fire, DHS2, and analytics. So, DHS2 is focused on analytics, is part of the core, and is focused on the program interventions. But sometimes it's challenging and tricky how to obtain the patient journey. The data that we have already in DHS2 about a patient, can we see the patient journey in DHS2? It could be tricky. FIRE is a standard that is patient-centered, that is used for exchange information. Our idea and approach is, could be useful to use FIRE in order to obtain the patient information that we are having from the data in DHS2. So today, at the beginning, I'm going to just to have an overview about what is FIRE, the difference in the analytics in FIRE and in DHS2. We would like to propose an architecture about how can we combine both of them in order to enhance the analytics. I'm going to show you a demo and some conclusions. So what is FIRE? How many of you know what is fire? So, okay, good, good. So, just to say that fire is a standard for exchange health data. Okay, is patient center. So one of the key things is the patient. Everything is around the patient. We were talking about that the data model is about resources. So we have the patient resource, observation resource, practitioner resource. It's standardized in different in XML or JSON and can be consumed using REST APIs, for example. And FHIR stands for Fast Health Interoperability Resources. So just to show one part of the data model, this is the specification of a patient with the different fields, the cardinality, what is the type. So everything is like really well defined. And this is an example of a payload of DHIS2. If you want to share information about a patient, what it looks like in JSON, for example. There's a male that is the John A. Doe, so with some information. So what is this situation, the current situation about fire? So we have seen a lot of increase in the popularity of fire. It's not the same in the all regions, as this study says. And we are seeing that a lot of donors are pushing for fire. And even in the DHIS2 community, there is several streams of work about fire that some of them we have seen during this conference. How to extract information from DHIS2 to fire, or how to push information from fire to DHIS2, or how to generate IGs, implementation guides, and so on. But let's talk about analytics. So analytics in DHIS2 are part of the core. Okay. The thing is that usually the analytics that we try to obtain from DHIS2 are like health program center. What is the percentage of coverage of the population in that malaria program? So the program is leading the analytics. But it's challenging in order to obtain. Imagine that we have a TI, a patient that is enrolled in different programs. It's challenging to obtain the whole vision of the patient. In DHIS2, it's easy to analyze through health areas and aggregated data sets. It's easy to combine to consolidate the information. But as I said, maybe it's quite challenging to obtain the patient journey. So sometimes it's difficult to obtain some kind of analytics like, okay, a person was enrolled in a TB program, and we want to follow up if that person was enrolled in a HIV program, what are the dates, and so on. Okay, what about fire? Good thing about fire is patient-centered. Bad thing that is analytics are not a core part of fire. There are some initiatives that SQL on fire, and they are evolving now. The good thing is that these initiatives are focused on the patient. So we would like to raise an open question. What could happen if we extract the data that we have already in the DHIS2, that is about the patient, extract to fire in order to analyze, transform to fire in order to analyze it, in order to obtain the patient journey, and maybe at the end put it back in the DHIS2 somehow? Before showing the proposed architecture, okay, fire analytics is not so easy because fire, the models and the resources in fire could be incredible okay, the complex, a lot of nested elements, and the data and for that the data transformation is not straightforward. You need to work on that. Also, performance issues, if you have a lot of information in Fire, could happen in millions of records. I need to take, as usual, you need to take into account security and privacy, okay, for the analytics. So what we were thinking is, imagine that we have one instance or several instances about information about the patients, mainly TI and events. And we transform that in a Fire instance, in a Fire server, as the Fire resources. That is, patient encounter is like an event, but we have observation, that is the data element of the event, and the location could be the unit. We transform it in a kind of something that we can query in SQL, a data warehouse, using a tool that is called the Fire Data Pipes. And we use it using BI tools like Superset, Power BI, or Tableau, okay, and put it back in the HS2, the visualization of the dashboards. That could be a different DHS2 or the same one, the beginning one. So let's talk a little about this piece in the middle, okay? Because we know the different parts, but let's talk about the one in the middle. So there is an initiative that is calling Open Health Stack, that is from Google, that offers a suite of open source component, okay? Is recognized as a digital public good, the Open Health Stack. And one of these components is the analytics. And inside the analytics, there is one component, this is the Fire Data Pipes, that can be used to transform Fire information into a data warehouse that can be consumed later for business intelligence tools. A key thing of the Fire Data Pipes is that you can host it in your own server. You don't need to send the data outside. This can work on premise. Okay. So let's do a quick demo. So what I'm going to show is this one. So I'm going to show a DHS2 instance with information about a patient. This information is transformed into Fire. From Fire, using the data pipelines, it generates a data warehouse. The data warehouse will be consumed by Superset, that is a visualization tool or BI tool. And this visualization is put it back in the same server. Okay, so let's start. So this is the DHS2 instance. Okay, we have a patient called Elizabeth Jones that is in the HIV program. Okay, just to show that in this program, he has a visit, she has a visit with HIV positive. Okay, but that person is also in the malaria program. Okay, glitches off. In the malaria program with another intervention, another event. Okay, negative in malaria, but also in the TB program. Okay, and TB positive with different dates and different information. So we have this in DHS2. We transform it in Fire. This is Happy Fire. This is a server that contains information already in Fire. So you can see here that we have a patient that is the resource in Fire. Okay, this one patient. That is Elizabeth Jones. And this patient is linked to 3 different encounters. The encounters could be like the event. is in one of them. So here you can see that there is the reference. So in Fire, you will have reference for the different kind of resources or instances at the end. Okay, and also we have added here information about a practitioner that is not in the HS2, but we have added in the middle. So at the end, we have almost the same information from the HS2 we have now in Fire. In order to, so let's go to the next steps, is the Fire pipelines. Okay, this is the tool, and we are running it like every hour. You can configure the things that you want to generate in the data warehouse. There's some kind of internal mappings, and at the end, let's just show the metrics. So it generates one patient, 3 encounters, 3 practitioners, and 3 observations, and also locations. Okay, so let's go to the next step. So we have now the information in our data warehouse. Let's use a BI tool in order to see it, to consume it. And from that, we are using Superset. Superset is an open source also. All of these steps are open source. Happy Fire is open source. Google Data Pipes or Fire Data Pipes are open source. Superset is open source. And the HS2 is open source. So here we have created a dashboard that is consuming that information. Okay, there is some kind of insight that you need to create data sets, charts, and in order to build the dashboard. Okay, but here what is important to see is that we have the patient and we have, you can see the patient journey. You have the different encounters. And if you select one encounter, you can see the observation. So when that person went to that clinic, was the test for HIV, and you can see that it's positive. And if you go to the to pulmonology, okay, I need to click here. It's positive for tuberculosis. So we can see here all the different events that happen for a person in a glance. But last thing is that what happened if we added that in the same DHS2? So we insert in a DHS2 dashboard, the dashboard from DHS2. So now in the same DHS2 instance, we have the data. So this is the source instance. And now in DHS2, we can see the patient journey of the person. Well, so that was the demo. And maybe just to say some conclusions, that ecosystems like with DHS2 and Fire can improve the clinical analysis. Like the Fire data pipes could enable some extra analysis on top of Fire, and this can be installed on premise, so we don't need to send the data outside. But as usual, we need to analyze each case separately. There is not a silver bullet for everything. And that's all from my side. Thank you very much. The question at the end, or?
Thank you so much, Carlos. We have one more presentation. We're just going to get ready.
Vou fazer a apresentação em inglês, pessoal.
Just questions, yeah.
Não, vou fazer só a apresentação inicial minha que vou fazer em inglês. Por resto, não, doutor. Não quero fazer, para não ter que me enrolar. Espera só.
So our presenter for this presentation is most comfortable in Portuguese, but we do have someone on standby for assistance with English
Tudo
translation.
em simultâneo? Não?
Left and right.
Okay, thank you. Good morning, everyone. My name is Esau Shambe. I am veterinary. I'm a specialist of animal health in Angola. I have a little problem with English. I will do my presentation in Portuguese, but Dr. Moss, he will help me to translate it. In my country, we have a lot of difficult for information about animal disease. Bom, we have four topics: the background, development, and of CISA. CISA is a system of information in animal health. The register with the implementations of the CISA, the challenge of the implementation of the platform for DHIS2. Bom, Angola é um país que tem algumas dificuldades com os sistemas de informação. Isso vão desde a limitação da informação, a debilidade nos sistemas de informação, a resposta tardia aos surtos e a limitação nos sistemas de vigilância. Com base a isto, o país identificou algumas dificuldades e selecionou a plataforma DHIS2, denominada CISA, que é para poder ajudar no registro de informações. O país tem já o sistema DHIS2 implementado a nível do sistema de saúde humana, mas a saúde animal não tinha plataformas que permitissem fazer a notificação das doenças e todos os outros processos. E tendo em conta as abordagens atuais que alinham os países para a resposta única a uma só saúde, há necessidade de os setores envolvidos terem as informações em plataformas que permitem fazer o intercâmbio de informações. Em base a isto, o projeto Redis 4 Angola, com o apoio técnico da Saúde Dígito, começou no ano 2024 com a implementação do DHIS2 como plataforma de eleição para resolver todos os problemas que aqui anteriormente já mencionei. Esta plataforma foi implementada em três modelos. No modelo de vigilância epidemiológica, para facilitar a notificação, bem como a coleta e tomada de decisões para a questão da vigilância. No modelo da vigilância laboratorial, bem como no modelo da vacinação animal. São os três modelos que nós implementamos, porque só começamos no ano 2024. Eu trago aqui alguns modelos das fichas desenhadas. Este aqui é o modelo para a vigilância laboratorial. Em função dos pontos de origem de informação, estes modelos estão padronizados e nós estamos a trabalhar com os técnicos para garantir a inserção dos dados. Tem as suas periodicidades, dependendo do tipo de informação, se é diária, semanal ou mensal, que é para garantir que se tenha informação nos níveis intermédio, provincial e nos níveis nacionais. O mesmo também se desenhou a nível do laboratório. Quando há um problema, um surto ou uma doença, faz-se a coleta da amostra. Desde o momento em que a amostra chega no laboratório, existe uma ficha em que se faz a inserção dos dados, e essa ficha tem um circuito todo. Entra pela sala de coleta de amostra, vai para a área em específico, a depender da necessidade, se era de serologia, bacteriologia, faz o processamento e a partir da senha no registro inicial, o técnico do laboratório consegue mandar o resultado para a recepção e depois dar ao utente. Todas essas ferramentas estão desenhadas, mas estamos num processo de treinamento dos técnicos para poder alimentar. A que já está 100% funcional é a vacinação animal. Aqui temos dois momentos. Tem o momento técnico, que é de vacinação do animal, e temos o outro momento, que é da coleta de dados. Acho que deixa-me passar para o próximo slide. A partir de um smartphone Android, ele traz dois modelos. O modelo para vacinação, bem como o modelo para os casos de mordeduras por animais. Se nós entrarmos para o modelo de vacinação, vamos para este campo aqui e temos aqui toda a informação que será necessária para obtermos a informação do animal e do seu proprietário. Para o modelo de mordedura, temos aqui a segunda tela, que é para obter os dados da pessoa mordida, bem como do animal agressor. Aquela última imagem, conseguimos ver um técnico no terreno a fazer a coleta de dados em função da necessidade. Bom, aqui temos também um modelo de coleta de dados no modo web, que é muito mais prático. Aqui temos algum exemplo de como é que o processo foi conduzido durante as campanhas de vacinação. Nós começamos só isso em 2024 e diariamente fomos ir monitorando como é que os dados estão a ser inseridos em função das localidades. Aqui temos os dados por espécie animal, bem como por sexo. E no final nós conseguimos obter as taxas de cobertura vacinais, em todo o território do país. Nas zonas em que o verde é um pouco mais acentuado, são aquelas em que se conseguiu ter uma cobertura acima dos 50% e as outras ainda estão um bocadinho abaixo. Isto diariamente permite identificar quais são os problemas que existem nessas localidades e que metodologias devem ser tidas para poder garantir que eles saiam desta coloração para chegar aos níveis desejados. Aqui temos alguns exemplos também que podemos ver, os locais em que são coletados os dados, e na outra tabela, no outro gráfico, nós vamos fazer o monitoramento em função das metas traçadas por dia. Os que estão a vermelho significa que no final do dia não atingiram a meta programada. Os que estão a laranja estão próximos da meta e os que estão a verde significa que passaram da meta prevista por dia. Já que onde não tem informação, significa que essas províncias não estão a registrar. E quem está a fazer o monitoramento vai contactar o supervisor da província para poder entender por que não estão a ser inseridos os dados. Esta foi a nossa experiência para o ano 2024 e 2025. Alguns desafios também foram encontrados, como a fragmentação dos dados nos três setores: saúde humana, animal e ambiental. A saúde humana já está muito mais evoluída. A saúde animal e a saúde ambiental precisam de crescer um bocadinho mais para poder fazer face à integração. Temos também o monitoramento diário da vacinação, conforme apresentei na tabela anterior. O nosso país, infelizmente, ainda tem dificuldades com a cobertura em todo o território nacional. Isto, de certa forma, dificulta no monitoramento diário de todos os animais que são vacinados. Além destes aqui, temos ainda também a questão: precisamos continuar a fazer o treinamento dos técnicos para garantir que todos os outros formulários aqui, desde a vigilância epidemiológica, laboratorial, bem como a vacinação, e outros que poderemos fazer, como também o registro de animais, todos esses precisam ser alimentados dentro de uma única plataforma para fazer a gestão da saúde animal do país e, posteriormente, poder dar resposta à questão de uma só saúde. Eu vou passar a palavra ao professor Dom Mos para dar uma breve explicação em inglês. Em todo caso, muito obrigado. Thank you. Thomas, professor.
If you have any questions, please raise your hand. I'm also checking the Zoom chat to see if we have any questions there.
Ok. Como tem inglês, então não tem problemas. Ok.
Who's got a question? Okay, I'm on the way.
Thank you. I would like to commend you for the good innovation of One Health, bringing data into one place, because I haven't seen it. I haven't seen it anywhere before. I mean, having the animal health and human health in one place. So, do we have what are the plans to ensure that we have the two data sets? How we can leverage the two data sets from both the human and animal
Animal
health
health.
going
Ok.
forward?
Quer saber? Sim, sim. Quer saber qual é o plano que o país tem para fazer a ligação? Sim, sim. Fala em português, eu traduz. Ok. Ok. Nós, a nível do... As doenças transmitidas aos humanos, 70% são de origem animal. Então, para poder fazer face à resposta assim, a estas doenças do fórum animal, que são chamadas zoonóticas, é preciso que cada um dos setores tenha informação. Se tu não tens informação, tu não consegues comunicar. Então, neste preciso momento, o que se está a fazer é alinhar o sistema de saúde animal para depois fazer a interligação com a saúde humana, porque a saúde humana tem o sistema DHS2 já instalado em toda a estrutura organizacional do país.
Yes, what's saying is that more than 70% of the disease that we get, they are coming from animals. So in order to combine in One Health, so you need information from these different kind of health, environmental health, animal health, and human health. So in Angola, they have DHS for human health. It's already installed, but not at the animal. So that's why they are trying to combine with this approach of One Health.
Okay.
All right, are there any other questions about any of the presentations? Okay, there's nothing in the chat. So I think you now have a coffee break before the next session resumes over in the plenary halls. Thank you guys very much. Thank you all for the presentations.